Dr. Ted James is a surgical oncologist and medical director with an extensive background in quality improvement in healthcare. He is actively involved in providing comprehensive care for patients with breast cancer, leading multidisciplinary care programs, and advancing patient-centered care through clinical innovations. Dr. James speaks nationally on transforming healthcare. He enjoys partnering with healthcare professionals to develop the tools, strategies, and culture necessary to help them achieve their goals in enhancing care delivery. Dr. James has been recognized nationally for his leadership and quality improvement. He believes that the key to achieving the best outcomes in patient care is to focus on meeting individual patient needs. Please welcome Dr. Ted James.
Well, quick show of hands. How many of you have been a patient in your own hospital? All right, so I'm not alone. Well, this happened to me about 2 years ago. I had an acute medical emergency which landed me in the emergency department of my own hospital. I'm fine now, thanks for asking. But it was really quite interesting because I had heard for many, many years from my patients about how great everyone in my organization was. But it was a very different thing to experience it firsthand as a patient myself. And I have to say that what I heard was completely true. From the nurse in the emergency room who made sure I was very attentive to alleviate my pain, to the emergency doctor who communicated with me and gave me updates on the test results and the treatment plans, to the medical assistant who was wheeling me from the CAT scan to the ultrasound and then back up to my room. And it was interesting, he was telling me jokes the whole time. And as he was helping me into my bed, he said, I hope you're okay with all the humor. I've heard that laughter is the best medicine. I just wanted to make sure I was doing my part. And people say, well, they rolled out the red carpet to you. I mean, you're a surgeon in your hospital. You got this Class A treatment. But I push back on that a little bit. I'd say that what I experienced, that level of care, it's not something that you can just turn on and off for particular individuals. It's something that has to be hardwired into the organization, hardwired into their culture. And I call it the culture of engagement. Now, we know that engaged clinical teams have many benefits. They improve quality. They have increased productivity. They drive financial performance. They improve retention. They create better care experiences for patients. And they make organizations more resilient. The fact of the matter is that engaged clinical teams truly transform culture, and transformed culture transforms organizations. Now, what do I mean by the culture of engagement? What exactly am I saying by that? I'm talking about people who don't just show up to work every day to do their regular job, but people who show up with the expectation and the dedication to go beyond expectations. I call these people gems because they persistently and consistently go the extra mile. This means that they have a patient-first mentality, and they demonstrate that in every one of their interactions. They provide caring like family members. And they have no excuses for excellence, because they understand that quality improvement is everybody's job. And the truth of the matter is that these individuals create tremendous advantages to their organizations, to their colleagues, and the patients that they serve. So what does this look like? How does this manifest? It manifests in very small but significant ways. It shows itself as making a little girl feel comfortable before going down to her surgery, by educating our patients so they're well-informed, which reduces anxiety, by celebrating wins with our patients so they feel good about their treatment progress, and by walking a patient to radiology instead of telling them how to get there. The truth of the matter is that the transformations that we're looking for in healthcare, the solutions to improving healthcare, are predominantly going to come from our frontline teams if they are fully engaged. So how do we do this? How do we get engaged clinical teams? Well, there's research that's looked at this, the science of motivation. Authors like Daniel Pink and Pronovost have published about this. And I've distilled this down to really three rules of engagement. Rule number one, promoting autonomy. You want to make sure that your clinical teams are intimately involved in the processes and the policies that affect their practice. What does this do? This gets immediate buy-in and accountability. And it drives creativity and innovation from your teams. Rule number two, you want to facilitate mastery. What does this mean? You want to make sure that you're doing your best to help your team do their best each and every day, giving them the tools and the resources that they need to be successful. A very good way of doing this, a very good strategy, is providing relevant and timely feedback. See, the truth of the matter is most people in healthcare, we're a little bit of that type A personality. We want to do a good job. I mean, no one wakes up in the morning thinking, I want to deliver mediocre care to my patient. I want to do a so-so operation today, right? We all want to do the best. And when we have data that's relevant, that's meaningful to us, and it's provided in a timely way that we can actually act on that information, that inspires us, it rises us to a higher level. Third rule, inspire a collective purpose, vision, values, hearts, and minds. What I mean by this is helping the clinical teams realize that their daily activity, their daily work from day to day, show them that connection in terms of how that impacts the lives of the patients we're taking care of. And sometimes we need to be reminded about that. We need to see that bigger picture. So again, autonomy, mastery, and purpose. These are your keys to unlocking intrinsic motivation that will drive that culture of engagement. Now, before coming down to Boston, I used to practice in Vermont. And I was actually a surgeon, but also the director of quality improvement at one of our cancer programs. And we really adopted this culture of engagement. We really dedicated ourselves to this purpose. And what I want to do is I want to share with you a story, a letter that I received from one of our patients that describes her experience at our breast center. I'm quoting here. The doctor found something suspicious during my breast exam. He knew I had a 3-hour drive from the hospital, so he arranged a biopsy to be performed that very day. The breast imaging staff knew that they would have to juggle multiple schedules so I could have the test that I needed that same day without having to make that long journey back home. They said, we will do whatever we have to do, whether it's working overtime or doing some very creative scheduling. And you know what? They did it. It was a real team effort. Fortunately, the finding was benign. You know, while every 6-month visit brings apprehension, I'm very comforted in the care and kindness the staff puts forth for every visit. In every experience I've had with the staff at the breast center, it continues to confirm my thoughts that I could not have found a better place for professional, quality, and thorough medical care. Please accept my accolades to your staff. They are a remarkable group of people. You know what they are? They're a group of people that have engaged in the culture of engagement. And we can provide this level of care for each and every one of our patients if we embrace the culture of engagement. So thank you very much for your time and attention.